In this tutorial, I'm going to show you how to use the balance disc for the neurospinal rehab exercises that you've been prescribed. We provide some of these in our office so that you can use them in our education room, but if you have the recommendation to buy one and have it at home, you're going to want to also do that and have one for your use at home. First thing is, the more you inflate it, the taller it will be and the harder it will be to have your feet on the ground. And that's okay if you want more of a challenge. It'll also be more tippy if you have more air in it. So keep that in mind when picking which one to use in the office and also how much to inflate yours at home. Now the first one we'll do is in this forward backward, this front and back plane. We're going to be bending forward and then bending backward. And the cue that I like to use is what you're doing with where you're looking. So basically you're going to look down and bring your belly button back. So down and belly button back, and then look up and stick your belly button forward. What that looks like from the side would be this. So we're going to look down and bring your belly button back, and then look up and bring your belly button forward. What you're trying to do is trying to work that full range of motion in this forward and backward plane. The second one that we're going to do is side to side. This one, you're going to bring your ear and your hip together. So kind of bring as close as you can, arc to the side like a C shape, ear to the hip, and then ear to the hip. So you're bringing your ear and your hip together and arcing and bending back and forth this way in the side to side motion. The third one is going to be rotation, and it's important to get your neck involved here. This is like checking your blind spot when you're driving a car. We're going to rotate. You might want to pick your elbows up, but rotate and look over your shoulder as far as you can one way, and then rotate and look over your shoulder as far as you can the other way. So those are the three different exercises. You'll have a recommendation for how much to do each one in your Principled Lifestyle prescription. In the office here, you'll be beeped in and checked in. You'll have about 3 minutes. So spend some time doing each one of those. And that's all with the goal of helping the process of getting your spine to align and spine to come back into alignment with the improved nerve signal. The neurological reset is reconnecting your brain to your muscles. So then when you go to move and go through these ranges of motion, that's when the physical alignment can take place as much as it needs to happen. So that's your job to be doing that. And on top of that, we say in the office, if you don't use it, you lose it. So you need to be using your ability to turn your head and look over your blind spot, or to bend over, or to look up if you don't want to lose it.